All right, welcome back. And time now for your COVID-19 questions. With me tonight to help guide us through them, of course, infectious disease specialist Dr. Bogoch. Thank you for joining us. Let's get right to it. We are a couple in our 80s with health issues. We're apprehensive about our dentist appointments. When's it safe for us to go?
Yeah, it's a challenging question. And certainly in Canada, across the country, this infection is under excellent control. We're only seeing about 300 to 400 new cases per day in a country of 38 million people. So it's relatively low risk. I think that people should certainly adhere to the guidelines in the local community. And if dentists are open and safe to go to in your local community, by all means, you should go. But of course, everyone's going to take their own individual assessment of the situation, and people have their own risk perceptions and risk thresholds and risk tolerances. And if it's okay for yourself, if you feel okay to go and it's okay in your community to go, then go.
Yeah, still so much stress about the basic stuff. Here's another one. My manicurist thinks the UV light used for shellac manicures will kill COVID-19. I don't feel she's right. I don't want to share nail polish with other patrons. What's your opinion?
Yeah, I wouldn't be so concerned with the nail polish. I'd be more concerned with close proximity to other people in an indoor setting for a prolonged period of time. And certainly we see now there's an outbreak in Kingston, Ontario, related to a situation just like that. Certainly if the area is cleaned down, if people are wearing masks inside, that will reduce the risk of transmission. And interestingly, related to the ultraviolet rays, there are some commercially available products now that use a certain type of ultraviolet ray, it's UVC rays, to help sterilize equipment or surroundings. It's not really safe to be in the room when they're turned on, but there is some evidence for ultraviolet light to be used to clean off surfaces.
Okay. Do you think it's safe that Blue Jays players and their staff have arrived in Toronto from a COVID hotspot that's Florida?
Oh, that's an interesting question. I think it's really important that we distinguish between player safety and public safety. And when we're talking about these players coming in, let's focus on public safety for a minute. Of course, we know that there are cases of COVID-19 in Florida, and sadly, that state has a significant number of cases. But when people come into Canada, they have to quarantine. And we've heard that these players are going to be quarantining in a hotel that's attached to the baseball field. So as long as they adhere to the quarantine and stay within that facility and they're not mingling outside of that area, there should be little to no risk to public safety. Now, of course, people in Florida and players who are coming in certainly might be at risk of having the infection, but as long as they stay and adhere to the quarantine, there really shouldn't be an issue with public safety. I should also remind people that day after day, there are thousands and thousands and thousands of people that come into Canada. Either they fly in or they come in across the border. So obviously this is an area that is under a spotlight because it's professional athletes. But when we look at the number of people coming in for this professional sport versus the number of people that are coming in on a day-to-day basis, it's really a drop in the bucket. So as long as they're adhering to the quarantine, there should be no issues with public safety.
Okay, briefly, you have time for just one more. I have a healthy newborn baby. Should I be completely restricting visitors due to the COVID risks?
Well, it's important that people adhere to the guidelines in their region. So, for example, in Ontario, you're allowed a bubble of 10. And if your baby, which would be included in that bubble, is part of that bubble and everyone else is adhering to the same care to make sure that they don't get infected, there shouldn't be an issue. If you're worried about people in your bubble that might be getting the infection, then you've got to really rethink who's in your bubble and allowing them access to your baby.
All right. As always, Dr. Bogoch, thanks very much.
Anytime.